Welcome, Duncan. I'm delighted to have an opportunity today to have a conversation with Duncan Selbie, who is the president of the International Association of Public Health Institutes, IAMPI. Now, this is an organization which has been around for some time, but in many respects, perhaps surprisingly, it's not as well known as it could be. So I think the first thing I need to ask Duncan, really ask you, is what is IAMPI and what is it supposed to do?
Well, Charles, IAMPI is a network of the leaders of the National Public Health Institutes around the world, currently 115 in membership in 98 countries. The pandemic has shone a light on the contribution of a National Public Health Institute, and there's an explosion of interest in the maturing of those institutes in the countries that have them, and the setting up of a National Public Health Institute in those countries who do not. IAMPI was born after SARS in the Far East, was funded initially by Gates to create a network, as I was describing, initially of just under 40 institutes. And so gradually over those intervening 15 and 17 years, we've seen the expansion of the network. The point to this is how do we support, encourage the development of public health systems and infrastructure all over the globe, essentially through peer-to-peer support. So this isn't about management consultancies saying we're here, we can help you, but about how sister and brother agencies around the world, called different things, sometimes authorities, sometimes institutes, sometimes agencies, to learn from each other and to support each other in a sort of a maturity index sort of way. So those countries that have a more mature infrastructure, supporting those with more development to do. The object, of course, is to have relevant peer-to-peer relationships. So east to east, west to west, south to south, rather than well-developed nations or well-resourced nations stepping out into countries who are less well-resourced and saying, we think you should do it like this. So it's very country conscious and country contextual. And I suppose in the net of all of what I just said there is based on peer-to-peer, a peer-to-peer network support.
Thank you. Two things just stick out from what you told me. One is the issue around maturing the institutes. And of course, there is great interest in that. There has been a pandemic, there still is a pandemic, and clearly issues of health security are enormous. So the maturing of those institutes, I assume, is associated with the health security components. In other words, detecting, tracking epidemics and pandemics, et cetera, But the peer-to-peer support is interesting, and the approach is interesting, because in essence, this is more of a self-help contextual approach, rather than asking a very well-developed health system to go and preach to others, because preaching is useful, of course, but preaching only works when there is the ability to actually replicate what was in the host country. And in many cases, there aren't. And as we know also, healthcare is not exactly something which is transferable from country to country. It is contextual in nature. So talk to me a little bit about this peer-to-peer support. Is this structured, or is this merely a series of conversations which, although useful, have their limitations?
Well, there are based on many years now of experience all over the world. There are tools and if you like, methodologies that exist and freely available and can be accessed by anyone around the world, about how you might go about establishing such an institute, including the legal frameworks that you may wish to consider, through to in-country peer review that can be provided at escalated cost, but at cost, not for profit, for an in-depth in-country review of where you are against the global index of where you may be, and what the steps might be that you should be taking, or you might wish to consider taking. And we've just completed, for example, a review in Estonia, which has got many reasons to be proud. But it's a small country that's punching above its weight, and it's thinking about how can it use its resources even better than it is now. So a number of countries, directors of countries, this is the leaders, the directors and chief executives, director generals of their own country institutes, traveling to another part of the world to spend 5 days and to get underneath what's going on there, all the different partners and all the different stakeholders, and internally and externally to the institute, and making recommendations. Now, if you're a low resource country, IAMFI will do this at no charge. If you're a middle income country, there's a small charge. If you're a high income country, then you do pay for the costs of this, and there's an element of that goes towards covering the costs of such a review in a low-income country. So it's quite an equitable, this is a process that is available to every country around the world. But there are lots of stages in between that, and we offer webinars, and through the pandemic, we were very active in shared learning and experience. We have regional networks for Africa, for Latin America, including the Caribbean, Asia and Europe. And we have programs of activity that run throughout the year that are tailored to the region but are open to the whole world. And then we have an annual meeting, and this of course was on hold because of COVID, but we were last in Ethiopia in December 2019. And this December, just past 2022, Stockholm in Sweden. Next year, we expect to be in Rwanda, in Africa. So there are many opportunities for directors and their senior teams to contact colleagues around the world to understand, who's doing what obstacles are being encountered, how are they overcoming them. The dream, Charles, and this is the vision for IAMFI, is that we can through peer-to-peer support get alongside every country in the world in a country contextual way. So within the circumstances in which they are operating, to develop implementable plans that funders want to fund. Now, for many partners, many countries around the world, they are dependent on external funding for investment in infrastructure. High-income countries tend to manage this out of taxation, but for lower-income countries, they are still very dependent on donors. We have the World Bank, we have the Global Fund, you've got the Gates Foundation, you've got the Rockefeller Foundation, you've got the Wellcome Trust, and many others. And the big ask of these big funders is implementable plans. And unsurprisingly, this is difficult for lower and middle income countries. And so IAMFI can get alongside and help to develop implementable plans that funders wish to fund. And this is the essentially what the strategy of IAMFI is for the next 3 and 5 and 7 years, and we're engaged in active discussion with the funding bodies. There's a huge amount of consensus that this is exactly what should be available, and what we need is to then match that with the necessary funding. Now, that's not a big ask. This is not about creating a monster of IAMFI. It's about creating technical capability that countries can draw on, and about creating small budgets that allow countries to release staff so that they can go and get the experience of being in another country, and to backfill and to pay for the normal duties to be continued. So we're talking here about, say $20 million over 4 to 5 years. It's the most extraordinary good value investment in creating real step improvement in infrastructure. By this, and I know you know this, and those listening will know this, we're talking about surveillance, knowing what's going on in your country. We're talking about laboratory science so that we can do early detection and that we can follow through on how variants are changing. We can react quickly and we can recover faster. It's about ensuring that we've got a workforce that's capable of being at the top of their game, not only during crisis, but in peacetime as well. And again, I'm very conscious that everybody knows that there are double jeopardy problems in many parts of the world where they're still facing the harm of infectious disease at the same time as non-communicable disease, which is overtaking infectious disease, and the harm and impact that it has on length of life and the quality of life when people are alive. So this infrastructure development, this investment isn't about just like a narrow thing about thinking about this problem of dengue or this problem of malaria or being ready for the next pandemic, but about how we are better ready and respond faster and more effectively to the health threats from climate change to obesity and every condition in between.
So this is helpful because, in essence, what you have described is a landscape which is much wider than the communicable diseases. This encompasses the non-communicable diseases. Yes. I.e., we are talking about the cancers, we are talking about the cardiometabolic disease, we are talking about all of that. So assisting a lot of the lower income countries in, of course, who are now sadly reaping the effect of, to a degree, the westernization of some of those countries, insofar as with that came the scourge of the non-communicable diseases in terms of diet and obesity, which comes with it, etc., etc. So that's quite an agenda, and it is basically there. Like, I mean, I'm paraphrasing. IAMFI is suddenly the delivery arm of the delivery of healthcare, and I mean, of course, it's going to play its part in that, but clearly there need to be other partners in this. And really, what I'm moving to now is asking you about your relationship with the World Health Organization, because clearly none of this is going to be successful unless, of course, IAMFI and WHO are actually working really in step with those countries. Otherwise, we could get into an awful lot of trouble, in my view.
So there's nothing, I hope, in what I've said that suggests that there's one single way or an easy or solitary answer to this. And of course, everything that ever matters in public health is about how you work with and through others. And our relationship with the World Health Organization has taken a big step forward in that we have agreed a memorandum of understanding about how we can work together to strengthen public health systems and infrastructure around the world. The WHO has the same aim as IAMFI, which is that every country, without exception, has the capability of implementing what the WHO call the essential public health functions, which we have touched on, of surveillance and laboratory science and community engagement and so on, and to be able to deploy against those essential public health functions and to be better ready and to respond in the event of an epidemic or a pandemic. But it covers the whole range of what you were describing there. So we are, if you like, an operating arm of the WHO, but in this very particular way of being part of government. Or I should have said that every institute is part of their government, that you can't separate public health from politics. It's simply an inseparable thing. If you want to invest in a strategy for obesity, do something about sugar reduction, or you want to do something about the availability of tobacco, or to do something about improving air quality and so on, then you need your politicians and your politics to be alongside. So the institutes within IAMFE are all, without exception, part of their governments, but they are independent, not of government, but to the evidence and to the science. And the evidence such as it exists, because it's important also to say when you don't know what the right next answer might be, or at the beginning of the pandemic, that was illustrated beautifully. So we are part of a network, we are part of a wider system, but we do have a big part to play. And as I say, through the pandemic, I think the entire world has become, everybody's an epidemiologist these days, and have been following genomics and what happens when variants, when things change. And I think the whole world is much more savvy now about why this matters so much. So there's a big step up for institutes around the world to meet that expectation. And I should have said earlier that it's not that higher income countries are better ready than lower income countries, middle income countries. In fact, the pandemic showed almost the opposite of that. That where we thought we were ready, we weren't. And it wasn't about resource. Certainly, at the very early days, there were parts of the world that were responding with much more acuity, and there are lots of reasons for that. But it wasn't all to do with levels of resource. But we know resource does matter, and we know that infrastructure does count, and we do know what we need to do to improve on that. So I hope to have somehow answered what you were asking there, Charles. Please.
No, I think you did. I think you did. We don't have much time left. Of course, we could talk for the next hour, but I'm just thinking it would be helpful to people who are listening to this to get a sense of, you're now president of this organization. This is an enormous challenge in front of you, especially as you don't exactly have, battalions of individuals ready to go out and assist you in actually achieving the aims of this organization, which we talked about. Yes. So there is a big challenge here. Now, if you have to be thinking after 3 years, 4 years in post, what the landscape would look like, what are your honest aspirations as to what you think you can deliver? Because clearly, this is not something whereby all you need to do is flick a switch and it happens. This is really complicated stuff, and it's going to take time. But what does good look like in 3 or 4 years?
So that's a brilliant question. I mean, Dr. Tedros, and I had the honour of meeting him. We were signing the MOU back in October, the World Health Summit in Berlin. He said, well, IAMFE has a very small corporate secretariat and a massive footprint in the world. And together, we need to rebalance that, not to create a big centre, but to create what I was describing earlier about this technical capability, in the various essential public health functions, the science and surveillance and the emergency side to public health, so that any country that is considering what it should be doing next can call on IAMPI, and we can deploy experts that are relevant to their context and their region of the world. We do need to strengthen our secretariat. It's based in Paris and in Atlanta in the US. And we do need to strengthen our presence in Geneva, because if you're in Geneva, you're much more engaged as to, things move quickly, and to be present is actually quite an effective strategy. So we know that what we can offer is very efficient, extreme value for money, but we do need to have the hands and the feet on the ground in order to be able to deliver that. So we do need to get investment. That investment, I'm very confident. You have to be optimistic, Charles, about when you're in this sort of, I'm absolutely convinced of the mission, and I'm convinced that the big funders buy into that mission. What we've got to do is square that route so that we can actually get some investment.
In 3 years?
Well, I think, I can tell you what we're not interested in, which is one-off funding to do something here and something there. That's not what we want. We want a global, whole world, international understanding that this matters everywhere. It sounds cheesy, but if everyone's not safe, no one's safe. We've just seen so much cross global. The movement of people and goods and infections have moved just as fast as the airlines can take people around the world these days, and we have to be concerned with how the whole world is getting stronger and better ready, and pandemic preparedness and all the things that underpin that. So I'm not thinking 3 years. I'm thinking that we will have secured the investment for the next 3 years by the spring, so by the time that we're meeting. And I hope to be able to share some news on that, and that we can begin the work. And then within 3 years, 5 years, and 10 years, that we have in membership of IAMPI at least 90% of the institutes of the world in those parts of the world where we can have the biggest impact, and that is literally, genuinely through peer-to-peer support. It is absolutely not about saying it works here, so why don't you try this, but about what are you trying to do, and can we conceivably help you with the expertise and experience that we have gathered from other parts of the world.
Thank you. Thank you for sparing the time, and we'll speak again in Helsinki, and we'll speak face to face in Helsinki. Thank you.
Thank you. Bye-bye for now, Charles. It's been very enjoyable. Thank you.